There is a difference between nursing and midwifery. They're not the same. So when you do your degree to become a nurse, you can only practice as a registered nurse. And that is everywhere in the hospital except in the maternity services. On the other hand, if you do your degree to become a midwife, you can only practice in the midwifery and maternity services and newborn area. We have bachelor degrees in nursing and midwifery, but we also have postgraduate degrees in a range of areas such as critical care, emergency, infection prevention and control, primary maternity care, and we also teach for PhD students who become a doctor of nursing or a doctor of midwifery.
I chose Griffith University for my degree because after much research I really loved the flexibility that Griffith offered with study. I wasn't sure if I would be able to maintain the full-time study load having a young family, but I knew that I could apply full-time and I had the flexibility to go back to part-time if I needed to, and uni would support me with that decision. I've always had an admiration for midwives, but it wasn't until I had my first child where I really got to see what they do and the impact they can have on your experience in childbirth, and so that sort of was my big eye-opener, and I went, oh, I've got to do that. That's amazing. So I went on to have 4 more children, and yeah, my passion just grew more and more and more from my own personal experiences. There's a lot of practical work involved in our degree. Obviously, being a health degree, it's very hands-on, and you can learn so much in theory, and you've got to have some theory to be able to put it into practice.
In both nursing and midwifery, it's really important that we have theory as well as practical. The theory is so important because you've got to understand why you're doing something to a patient. The practical is we're preparing you to be able to do those practical skills, and we do that in simulated laboratories.
The simulations are great because they replicate the hospital exactly, so we can walk into a lab and it looks like we're at the hospital. All the equipment, all the medical supplies that we're using at the hospital are what we have here in the labs, so we can, just get used to the feel of everything, and gives us that confidence when we walk into the hospital.
What sets Griffith apart is our attention to students, making sure that the student experience is of top quality, but also that our students are highly satisfied with their learning experiences.
There's never really a right time if you wait for the right time. If you've got support around you, if you've got a passion for it, just jump in and apply. You won't regret it.